The ocean covers 70% of the globe. It gives us oxygen and food and millions of jobs. It brings joy and shapes our climate and weather. The ocean is life, and it belongs to everyone. Woods Hole Oceanographic Institution is the world's independent leader in ocean discovery, exploration, and education, working to understand and sustain one of humanity's most precious common resources. Join us today for our ocean, our planet, and our future.
Good evening, everyone. Welcome to WBUR's 5th virtual town hall. Tonight's town hall is sponsored by the Woods Hole Oceanographic Institution. Thank you to them for helping make tonight's event possible. I'm WBUR's environmental editor, Barbara Moran. We appreciate having all of you with us this evening, even though we can't see you, we know you're out there. Thank you for coming. This event is hosted by our team at WBUR CitySpace, where we look forward to seeing you someday in the future in person. Tonight we're live streaming to our YouTube and Facebook pages, as well as to WBUR.org. Don't forget to just subscribe to the WBUR YouTube channel to get notified anytime we release a new video. You can also click on the bell icon right next to the subscribe button if you want to be notified whenever we go live. Our topic for tonight is the connections between COVID-19 and climate change and how action on climate could protect us from future pandemics. Tonight's guest is Dr. Bernstein, a pediatrician at Children's Hospital and interim director of the Center for Climate Health and the Global Environment at the Harvard School for Public Health. Dr. Bernstein focuses on the health impacts of the climate crisis on children's health. Last year, he testified before Congress on the subject, drawing from his personal experience as a pediatrician treating children with breathing difficulties, vector-borne diseases, and trauma from natural disasters. Dr. Bernstein also leads Climate MD, a Harvard program to encourage physicians to transform climate change from an issue dominated by politics to one that matters to every person's health here and now. The noble goal. Thank you so much for being with us, Dr. Bernstein. Great. So a little bit of housekeeping. We'd like our audience to be part of this conversation too. Do you see the parallels between coronavirus and climate, and what do you want to know from our guest? We're taking questions at slido.com. You can go on the internet and enter the event code, which is WBUR-VTH5. That's like WBUR Virtual Town Hall 5. You don't need to download an app. You can do it right in your device's web browser. And we've already had lots of great questions submitted, so we'll try to get to as many as possible. You can also check out the YouTube live chat and talk to others who are watching and exchange ideas. Okay, great. So now that we're that out of the way, we can get started. So I'm going to take the moderator's prerogative and ask you the first question, Dr. Bernstein. So it's interesting to hear a physician talking about climate change. And I was wondering if there was a moment in your career where it started to connect for you. Like, I assume they don't teach you a lot about this in medical school, right? So was there a moment, was there a specific patient or a group of patients that made you start thinking about this connection?
Well, it did take a while, and I'll tell you about it. But I'm really happy to have the chance to talk with you tonight. We've got some good things to chat about because I think there are some really important opportunities in the midst of this mess to do some good stuff. People ask me that all the time, what the heck is a pediatrician doing talking about climate change? And I remember clearly when I went to medical school and I was starting to realize that my past interest at that point in climate change was, at least in my mind, connected to health, but no one was talking about it. And I went to the dean of our medical school, who was Larry Wood, one of the most wonderful people you'll ever meet, totally thoughtful, totally behind me. And I said, how can I figure out how to put these things together, climate change and health? And he looked at me very sincerely and he said, Ari, you're trying to fit a square peg into a round hole. Now, to this day, I'm not sure what the heck he meant by that, but it was pretty clear that I was sort of barking up the wrong tree. Well, fortunately, I had some other mentors to reach out to. And as I pursued a path in medicine, I decided to become a pediatrician. Pediatricians do the most amazing things, in my view, because our job is really to keep children healthy. We're not we do take care, obviously, of children who have to get sick, but primarily what we're supposed to do is to keep kids out of trouble. And from that perspective, I sort of felt as though there's a ton of stuff I can do as a clinician, but it's not going to matter a heck of a lot if we don't do what is probably the most important thing to keep children healthy, which is to deal with climate change. And I recognized that pretty early on in my training. I was very fortunate that early in my life, I had people teach me about climate change. I mean, I had the most amazing 7th grade teacher in the 1980s talking about climate change. I got to learn about climate science from Steve Schneider when I was in college. Steve was on The Tonight Show with Johnny Carson in the 1970s talking about climate change. So I was primed for this. And I'm happy to say that these days it's ever more common that people who are medical doctors see this the same way. And we recognize that climate change isn't just a health challenge. It matters to our ability to do our jobs in the clinics we work in the hospitals we work in. And that's really important to understand, because part of what we need to deal with here is the reality that climate change matters to health, but it also matters to healthcare.
Right. I wanted to because I do feel like a lot of people have a hard time making the connection, and a hard time making the connection between coronavirus and climate change, right? So I wanted to just show a couple photos and talk about a specific example to try to help bring that home. Sure. So this, I think, we could bring up that first picture, Alex, of Chelsea. I just gave away my big, there we go. Woo, it's working. Okay, great. This is a photo of Chelsea. For those of you who don't know, it's a small city north of Boston near Logan Airport. It is actually the smallest city in Massachusetts, but the second most densely populated city after Somerville. And we've done reporting at WBUR about Chelsea because it's really vulnerable to climate change, both to sea level rise around Chelsea Creek and also to increasing heat. And Martha Beevinger did a story about Chelsea being a heat island a few years ago. And interestingly, or sadly, tragically, it's also at the epicenter of COVID-19 in the state, right? It's a high COVID-19 infection in the state so far, rivaling the rate of New York City. There's another picture of some testing going on. And there's a couple reasons for that. One is that 80% of the workers in Chelsea are essential workers, meaning they don't have the luxury of staying home from work. They rely heavily on public transportation. They only have a few really crowded bus lines there, so that's another way that they get exposed. But there's also some other data coming out suggesting a connection between climate change and COVID-19. And I was wondering if, Dr. Bernstein, you could talk a little bit about that and maybe talk specifically about Chelsea and the connection there to help bring it home to people.
Yeah. So the research I think you're alluding to, Barbara, is the research that is emerging that's showing that air pollution is increasing the chance that people may die from COVID. Colleagues of mine, Zhao Wu, Rachel Nethery, and Francesca Dominici at the School of Public Health have looked across the United States and found that long-term exposure to air pollution, so not what you've breathed in the last week, but over the last 15 years, that small differences in that, on the order of 1 microgram per meter cube. Now, to put that in perspective, the average American probably breathes air with 8 micrograms per meter cubed of this stuff called particulate matter, which is any sort of stuff suspended in the air. That 1 microgram per meter cube difference over the span of 15 years might, increase your risk of dying from COVID by 8%. So, or increase the mortality rate, I should say, by 8%. So, and that's accounting for a whole host of things that one would expect might affect your risk of dying. And that's, emerging research, right? So they've submitted that for publication. It's under peer review. But it's important to recognize that there are lots of other studies on COVID and air pollution now, maybe a half dozen or so from around the world, that show similar things. And there's a lot of other research showing that air pollution is bad for causing respiratory infections and for risks of people getting sicker with respiratory infections. So frankly, it's not terribly surprising that research on COVID is showing that. And in the context of Chelsea, we know that air pollution there is worse than many other areas in the state. And so the people who've lived there, their lungs may have been affected over time by breathing worse air. And that may be a setup to more severe illness with this infection.
So talk about some maybe specific policies that the state or the federal government might be able to institute that could help protect people somewhere like Chelsea against climate change issues and also against, future pandemics and other illnesses, or even
Sure.
this pandemic.
One of the things that the pandemic makes so clear is that we have this enormous opportunity to get benefits across a whole series of threats, like COVID, like climate change, like air pollution, like health disparities, through the same core set of actions. So, when you look at Chelsea, or many places in urban areas, air pollution is coming from burning fossil fuels. In Massachusetts, the state, we've got probably about a quarter of that from transportation. We've got probably half of that from big buildings, and then another quarter from homes. But in highly dense urban areas, the people's exposure comes from usually traffic and, a good amount if you're burning stuff in homes that's local. So heating oil in particular. So that means that if we can get our transportation systems and our off fossil fuels and our homes off fossil fuels, we will decrease rates of air pollution that are causing problems like heart attacks and strokes and premature births. By the way, I neglected to mention that aside from this risk of air pollution increasing the mortality rate from COVID, we know quite clearly that air pollution is a major cause of the diseases that we know increase risk for mortality, right? So we've seen lots of epidemiology showing that people who have high blood pressure, who have heart disease, respiratory disease, and diabetes are more likely to die. Well, particulate matter air pollution causes all those things. So if right now, there's the RGGI, the Regional Greenhouse Gas Initiative, which has done and that's a policy that essentially works on the electrical grid, on the source of electricity that goes in the electric grid, to decarbonize them within a suite of states in the New England region. And that has really reduced the amount of greenhouse gases and also helped to reduce air pollution. And that reduced air pollution, of course, has all the benefits that come from less air pollution, less asthma attacks in children, less heart attacks in adults. Okay. We're now trying to do the same thing with the transportation corridor. So there's the Transportation Climate Initiative. That the idea there is very similar. We want to decarbonize the transportation corridor between New England and New York. So our job here is to make sure that we don't just focus on carbon, but that we focus on health, and particularly in the communities like Chelsea, where the pollution has hardest, primarily because these communities are the poorest, and that pollution and poverty are bedfellows almost anywhere you look. And so we have real opportunity here to deal with climate, to deal with air pollution things, to improve health disparities that result from pollution exposures, and of course, to make people healthier right now. When you stop burning, we're seeing right now the effects of not burning fossil fuels. Air quality is improving in places around the world because, we're not using as much energy, and that's saving lives. So these are pandemic solutions. They're climate solutions. They address health inequities. And most importantly, they make people healthier, and particularly the people who are most vulnerable in communities in which they're taken, right? So if you turn off the power plant near a city, it benefits there. If you decarbonize transportation in a community like Chelsea, it matters to people in Chelsea.
Great. If anybody out there is just joining us, we're live at a WBUR Town Hall with Dr. Aaron Bernstein talking about coronavirus and climate change. We're happy to take your questions at slido.com. The event code is WBUR-VTH5. And we just had a question come in for you, Dr. Bernstein, along the lines of what we're just talking about, and it's about housing. And you touched on this a little bit, but there is, as you know, a housing crisis here in Massachusetts. And how does that tie in or could tie in with climate resiliency and health? I mean, how do you see that working into this question?
Yeah, no, it's a wonderful question. So let me come at it from a couple different ways. The first is that, in Massachusetts, as in many places in the United States, it turns out that the less money you earn, the more money you're likely to spend as a percentage of your income on home energy needs. And it turns out that people who tend to be poorer have the most energy efficient homes. And on average, in the United States, and this is one of the shocking things, somewhere between 30 or 40% of the energy that goes into homes is lost. It's used for nothing. And that's because it goes through the roof, because it's not well insulated, through the windows, because our furnaces aren't, all these things. We waste a lot of electricity. And so one of the ways to deal with housing insecurity and the fact that home costs are going up is to, in fact, improve energy efficiency in homes. And now everyone in Massachusetts actually pays through our utility bills into a fund to actually help make this happen. So through the Mass Saves program, people can in fact get substantial discounts on insulation in their homes, on getting thermostats to control, discounts on boilers, zero interest loans. That this is a really good program that unfortunately, in my view, doesn't get used enough in the communities that need it most. But nonetheless, this is a critical part of the housing issue, which is the cost of housing, and that, in fact, we need to address the fact that energy costs are the most acute for people who have the most housing insecurity. There's no question from a climate resiliency standpoint that having housing stock that's resilient to climate is important, and that is in part heat related, right? So, we're seeing 2019 is the hottest summer on record. It's possible that's going to happen again. I really don't want to be around, frankly, if we see a resurgence of COVID with a major heat wave in terms of what it means for healthcare. But that's not impossible. But, we have in Boston, again, the people most at risk are in places where there's 3-story walk-ups, you're on the 3rd floor, and there's no air conditioning. So, part of the improvement of home energy efficiency is making sure that if we're giving people, if people are installing air conditioning, have air conditioning, that it's as efficient as possible. So we need to do that. We need to cool things down through greening, right? So there's this great, like in Chelsea is a great example. The urban heat island in Chelsea is the greatest in the city. That means that if they have air conditioning, the costs are higher because they have to cool off greater. So by greening places like Chelsea, although as you saw, there's not a lot of room to put trees, which means we have to do roofs, right? So the point is that greening decreases energy use both in the winter and in the summer. So especially green roofs have been shown to insulate in the winter better than, people say, why not just do a white roof, which is good. It's cheaper, it's easier, but a white roof doesn't get you the insulation value of a green roof. And then the green roofs actually are better in both seasons in terms of their energy properties. They also, and this is in terms of flooding risk in Chelsea, they absorb runoff. So one of the risks for flooding in a place like Chelsea is because everything is paved, it all runs off into rivers. And if we get a big storm, that creates more flooding. So urban greening is a solution for air pollution. It buffers air pollution from fossil fuels. It's good for that. It buffers water from runoff, which is not just a risk for flooding, but for waterborne disease. It decreases the urban heat island effect, so people are less at risk from heat-related diseases in their communities, and their energy bills go down. So that's a no-brainer. The only challenge there is, the housing stock, and can you support a green roof? And where can we incentivize green in places where it's most needed? You look at Boston, it's a total equity issue. Where it's green, people are richer. Where it's less green, people aren't as well off. And so, the housing piece is a critical part of both resiliency and reducing emissions as well, because when you cool off cities, you don't burn the electricity or the oil or the whatever for the heating needs, right? So it's actually reducing emissions as well.
Great. This is another listener question, since we're talking about heat, and this is tangentially related. So a listener asked that they heard the virus thrives at lower temperatures, and this has been in the news a bit lately. So the summers are we know that summers are going to be getting hotter. Will hotter summers be bad or good when it comes to viruses like this one? Like maybe it'll work out if all the warming kills all the viruses.
Hold on a second. I have a crystal ball over here. I'm just going to go over here for a second, and I'll come back and just join. So this is, so I'll say a couple things about the warmer is better, the summer miracle idea, as it has been called. So the best available evidence, which I will be the first to say is not particularly great, shows that this virus is probably going to slow down when it gets warmer. The best available evidence also says that slowing down is not going to, in fact, slow it down enough to prevent rapid spread. And, it's sort of obvious. I mean, look at what's gone on in New Orleans or in Singapore, right? So clearly, it's not as though if we get a heat wave, this is just going to vanish, right? And so regardless of the climate, the virus is probably going to be able to spread based upon how immune the population is, how many people have been infected, how much we're congregating with each other, and how much, we're moving around. Like, those are big factors. Is the temperature going to matter? Absolutely. But I think it is a really not good idea to bank on that, especially since we know it obviously can transmit in very hot, muggy conditions in places around the world. And again, think about what I said a minute ago, which is that we know that when the temperature goes up in Boston, and Boston is particularly the canary in the coal mine for heat and climate change, because one, it's warming up in Boston faster than pretty much anywhere in the United States, save for Alaska. Two, our culture is not adapted to heat, right? So you go to the Deep South, people know you have to be in air conditioned, everything is air conditioned, And so we actually have some of the highest risks from heat on that basis. And so you can imagine a scenario in which we're like, we're not doing this. I'm very grateful to our governor and others who are in public health who have really seen that we are, I think, taking very appropriate measures to protect ourselves from this. But if we were loosening up, restrictions rapidly and we had a resurgence of COVID with a first summer heat wave, it could be a real mess in terms of our healthcare facilities and their capacity to deal with that. I mean, I was in Chicago during the heat wave of '93 that everyone talks about, where they had to use semi-trailers as morgues. We don't want that. I take my word for it. We don't want it. And we certainly don't want it when there's an enormously contagious pathogen circulating in the community. So, I think that we're being cautious. We're being appropriately cautious. I wish there were more testing available. But I think that piece of climate risk is quite real, and it needs to be considered in how we think about opening up our society.
Can I ask you, this is probably a dumb question, but I don't actually understand why air temperature would conceivably affect the spread of a coronavirus. Like what? Yeah. What? I don't get it. Can you explain? Is there a way to explain this?
Yeah. So I mean, to be clear, as I said, we're not exactly sure it makes a big difference. But with other viruses, like, we know that there's a very strong seasonal. So there are very strong seasonal patterns. In some cases, like influenza, I think it's relatively well understood. Part of it is certain viruses do better with humid air versus not humid air. And part of it has to do with the ability of the virus to be transmitted not only by the temperature and humidity air, but by like the fact that school's in session, everyone's closely congregating. So like flu is this great combination where it does really well in like cold, dry air, and everyone, comes together. Interestingly, coronavirus, when I was a medical student, there are lots of other coronaviruses that infect people that aren't this one or SARS or MERS. And it was originally described as a, quote, summer cold, because and that turns out to be somewhat of folklorishness, because I think that what happens is that the real cold viruses, like the rhinoviruses, really do surge in the winter. And so what's left in the summer are other things but I think coronaviruses actually do quite well in the winter too. And there's some people, like the head of the CDC was saying, we may see another resurgence in the fall. So, air temperature, humidity may affect the ability of the virus to actually transmit. There may be some effects in things like influenza about the dryness of the air and our defenses against it. The fact that seasonalities also comes together with how people, hang out together.
Yeah, interesting. For those of you who are just joining us, we are live here with Dr. Erin Bernstein, who's a pediatrician at Boston Children's Hospital and also at Harvard School of Public Health. We're talking about the connection between COVID-19 and the coronavirus. No, the connection between coronavirus and climate change. We already know that last one. Sorry about that, everybody. If you are out there and would like to ask us questions, please go to slido.com, and the event code is WBUR VTH5. We just had a question come in about climate change and pandemics. And does climate change increase the probability of pandemics worldwide in general? And are unique viruses more likely to emerge in a climate changing world? So this isn't just heat per se, but climate change and pandemics and emerging diseases.
Yeah, no, it's a great question. It's on so many people's minds right now because everyone wants to know, are we ever going to have to go through this again? And I certainly hope not. And I hope we can get to that because I don't think we have to. I think we actually know how to prevent these things from happening. The specific role of climate change is, we know that climate change has already probably made some diseases appear in places that they've never appeared before. In New England, we're acutely aware of this with the spread of Lyme disease. But there's also Vibrios, these bacteria that live off the coast. You talk to people who are, people harvesting shellfish, and they'll tell you about how they've had to close down the oyster beds because of these Vibrios. There have been these bacteria Vibrios are really tropical diseases in the waters, but it's been warm enough up here to get them to survive up here. They've even shown up in Alaska now. So there's a real important distinction here between disease emergence, like the appearance of a disease like a Vibrio, and a pandemic, right? So these emerging diseases, which can include things like SARS or which is another coronavirus that happened in 2003. There are other viruses that people may have heard of, like Nipah virus. These are emerging viral diseases that are not good, but they didn't become pandemics. And they didn't become pandemics for a variety of reasons, and a large part to do that the viruses may not have been as transmissible as this one. But a big part of pandemic risk is the reality that we live in a world in which there's in the normal times, tens of thousands of flights that take people around the globe in a few hours from cities with millions of people living in high population density. When I was born, there were, no cities on Earth with 10 million people. And now there are quite a few cities with 10 million people. And that really matters to pandemic risk. So you give a virus in particular the chance to take root in a very dense place. Now, let's be clear. The solution does not mean let's stop living in cities and stop flying. Those are not viable or even wise decisions. The decision is in recognition that we gain so much from living in cities and from being connected, that we need to prevent these pandemics at their root. And the root of these pandemics has everything to do with how we're doing business with the biosphere. Not necessarily the climate, although it is possible the climate is making creatures move places that they don't want to be, like up mountainsides and towards the poles, and that creates the potential for animals where we know that 75% of these emerging infections are coming from, may bump into people. It's more likely the case that we people are actually going into forest and wilderness and, coming into contact with the animals and getting infected that way than they're winding up on us. But nonetheless, we know how to prevent these diseases, and we need to invest in that because those costs of, dealing with the wildlife trade, dealing with deforestation, dealing with, people essentially in rich countries asking people in poor countries to go into the wilderness to find them an exotic animal to be their pets. We know how to fix these things, and the cost of doing so is I'll give you a clue. It's not the $7 trillion we're spending right now to deal with one of them. It's probably it's not cheap, and we're actually doing this math right now. But, to deal with those things is probably in the order of hundreds of billions of dollars. But the bottom line is whatever the cost is, we can't, imagine, and my line of work is sadly in many days to figure out what the worst case scenario is and make sure that never happens, because no one wants to lose a child. Well, now the planet is a child, and we can't lose it. Can you imagine a scenario in which we know that 2 viruses, and this is probably an underestimate, but at least 2 viruses go from animals to people every year. On average, over the last decades, there have been 2 viruses covered. Now, most of those don't do us any harm, which is good news. But what if we had a year with a pandemic flu like 1918 and a coronavirus year? There's nothing to stop that. We have to prevent these things. We have to. And the good news is we know how to do it. And so what I really hope is that we see this is nature telling us something. This is our spear in the chest moment to say, we need ventilators and we need ICU beds and we need people trained to how to do these things and we need PPE and we need hand sanitizer. If anyone knows how to get some hand sanitizer, can you let me know? I'm running out. But that actually is going to be completely useless in the face of these recurring pandemics. I mean, it is completely inadequate to the challenge we face. And the good news is that, by the way, many of these things we need to do, like preventing deforestation, don't just forestall the next. They prevent climate change. Deforestation is 10 to 20% of carbon emissions. And they have a huge host of other benefits. So, these are no-brainers. These are no-brainers. And so I think it's critical that we get that investments in conservation, in protecting nature, are good for protecting nature, which has a right to exist on its own. They're good for preventing climate change, which causes lots of problems for lots of people. And they're good at preventing pandemics, which we simply can't afford to have in our world, which is enormously interconnected and increasingly densely populated.
You touched on a lot of questions I had about sort of global or national policies about deforestation and land use. Can you say anything about like the food supply chain and as far as that with climate change and health? Do you see any opportunities there?
Well, I mean, the obvious one is that we know that, emissions from beef in particular, and I'm sure I'm going to get hate mail because of this, but the reality is the science is clear that, red meat is order of magnitude more carbon intensive by any measure than pretty much any other form of food that people eat. It also turns out that eating lots of red meat, and particularly processed red meat, kills you. It turns out that fossil fuels, which are responsible for 80% of climate change, also are totally embedded in the food system, meaning that all of the fertilizers we use require fossil fuels. Almost all the herbicides and pesticides require fossil fuels. All the farm equipment requires fossil fuels. And air pollution emissions from agriculture are actually a major contributor to air pollution to people in those parts of the country and the same health problems. So if we can find a way to eat less red meat, we'll be healthier, we'll prevent carbon emissions. If we eat more plants as a result, we'll also be healthier and have less carbon emissions. If we're able to decarbonize agriculture, we'll prevent lots of air pollution. If we find ways to do regenerative agriculture, which has carbon stored in soils, and there's some really good work going on to try and figure out how to make farming much more sustainable in that regard, we can actually sequester carbon in our agricultural resources. And then by stopping reliance on fossil fuels, we'll prevent air pollution that's killing people. And so whether we're talking about the diets that people eat or the way agriculture is practiced in the United States around the world, there are real opportunities to get double wins here for immediate health and for climate change. I should mention there's another piece to this that connects to pandemics and climate, which is that the leading cause of deforestation in the world is agriculture. More forests are being chopped down to raise food. In the Amazon, it's for cattle ranching. In West Africa, it's for palm oil. In Southeast Asia, it's for palm oil. Well, most of that is happening to drive local economic needs, like people need an income. So it turns out there was a wonderful period in Brazil between 2005 and 2012 where the global community was able to essentially find ways to provide financial incentives to Brazil to protect its rainforest, essentially giving money to Brazil to say this carbon in your forest is worth something to us as a global community. So, by the way, deforestation is not just bad for pandemic risk. It brings out a lot of diseases locally, like malaria and dengue, which is bad. But the important part about that is that the cost of doing that was far less than people expected. And that agricultural yields actually increased in Brazil in that period, because one of the thoughts is you need to clear more land to boost yields, which is not clearly the case. And there's less disease emergence. So again, you prevent deforestation, crop yields were better, less carbon pollution, better health. And the other, of course, is in places like Southeast Asia, their slash and burn agriculture has caused fires that have killed 100,000 people at a pass from the air pollution. So, again, these connections between food, climate, health, and risks of infections are real. And again, the great news is that these solutions are one and the same. And so we have compounding interest on the investments in that.
This is another question from a listener, which it isn't really about policy, but it's about this particular pandemic and what's happening now. But since the shutdown of how long it's been, I don't even know, it's been like one long day, but 2 months since everything shut down, there's been this huge drop in travel, both air travel and car travel. And there has been a drop in emissions and cleaner air, but it hasn't been that big of a dent in emissions as everybody suspected. And this year is still on track to be like the hottest year on record, I believe. So what's up? I guess everybody thought, everything was going to go away, and it kind of went away a little bit, but not that much. Can you talk about that a little bit?
Well, there's carbon emissions, and then there's other air pollutant emissions, right? So we've seen decreases in the particulate matter I was talking about before, and in Europe, there's an estimated 11,000 lives that have been saved because of the decreased particulate matter. And people's lives are probably being saved in the United States because there's been less of particulate matter air pollution in particular. But the other kind of pollution is carbon pollution. And the difference there is that, there's a carbon cycle on Earth, that when carbon goes up into the atmosphere, it doesn't just go up and sit there. It can go into trees. It can go into oceans. Over very long time periods, it can even get into things like rocks. So there's a period of time that the carbon is sort of balancing out through all these potential sinks in the environment, and those sinks actually can release it back into the atmosphere. So we don't see this sort of, very tightly connected pattern where you stop emissions and all of a sudden, the atmospheric concentration changes. And in talking to some people who are climate scientists, it's not clear that we're even going to see a blip in the CO2 radar. If this goes on long enough, I'm sure, we would have to, but certainly over, the next several years, my expectation is the real difference in where we're headed is based upon the actions we take right now with our economies and how we decide to invest in renewable energy, transportation systems that don't rely on fossil fuels, all of these things we know that are part of the carbon pollution solution set. That's what's going to bend the curve on carbon emissions. And this present gap, I think, is noteworthy because I think people can look out their windows and see a difference in the color of the sky in many places in the world right now. And we can ask ourselves, wouldn't we be better off having air that was clean enough that we were, not having our health harmed needlessly? That it's sort of hopefully a moment that can give people recognition that something better is possible.
On the flip side to that, you hear skeptics saying well, look, this is how you get a little bit cleaner air is by destroying the economy, right? Yeah. Right. So, I do hear that sentiment out there, the setting up this dichotomy of this is what the environmentalists want in order to get rid of, to lower carbon. You're going to have to shut everything down, stop flying, all this kind of stuff. So how do you square that?
So two things. One, if only that were true. And two, I'm not an environmentalist. I'm a doctor. And the reality is that if you look at the data, the Clean Air Act in the United States, which is the main rule that has improved air quality for everybody. I mean, there are gross disparities in exposure today, but compared to when I was born, the air quality in the United States is way better. We've watched as the pollutants that kill people fall by 60, 70%. The GDP of the United States has grown by more than twofold, 2.5-fold. And every shred of evidence suggests that the more we protect the air and water of the country, the better our economy gets, because that pollution makes people sick, and people who are sick don't work well, and people who are dead don't work at all. Now, there's a very different calculus in a place like India, where lots of folks don't have access to electricity, and not having electricity is really bad for health. So in that environment, the question becomes, if fossil fuels are apparently the cheapest option to buy off the shelf, is it better to do that and make pollution that kills people, or to leave people without electricity? And that's a much different choice. Of course, if they actually accounted for the damages associated, forget about the carbon pollution, just the air pollution damages, the cost benefit even there would show that they'd be far better off not polluting. But that value isn't in their calculus. Just as in the United States before the Clean Air Act, we were pretending like air pollution didn't matter. But it does. There are real economic effects, and I will tell you with absolute certainty, there are very strong health effects, and not just in premature death, for people I take care of. And, children who, 1 in 5 children in the United States today, by the best science, has asthma because they breathe tailpipe emissions. And it's not just asthma, it's birth outcomes. We have evidence that shows that fossil fuel pollution is making pregnancies outcomes worse. We have evidence that it's affecting our children's brains. And the more we look into this stuff, the more stuff we realize that air pollution is really bad for. And so, this argument that, cleaning the environment up, dealing with pollution costs money. It's not that it doesn't cost money, but the question is, what are the benefits? And I just, if you can allow me one more point, because I do want to make one more point on this question, which is, for those of us who see the imperative of stopping our use on fossil fuels, we have an unforgivable habit, which is not to acknowledge the reality that for hundreds of thousands, if not millions of people in the United States, their life depends not just on fossil fuels right now for like our conversation, which it absolutely does, but for their jobs and for their families. And the idea that we would propose a transition away from fossil fuels and pretend that these people do not exist and that we are not threatening their livelihoods is immoral. And we need a plan. We can't proceed as if the green economy is going to appear and the fossil fuel economy is going to disappear. I'm not so concerned about the fossil fuel companies. I'm concerned about the families who live in parts of the country who are involved in mining coal, who are involved in extracting oil and gas, and all the companies that service that do me enormous value every day. And by the way, those jobs are not exactly the safest jobs. And to suggest that we don't have a responsibility to those communities, perhaps more so than any other right now, is irresponsible. Now, I wish I had a magic wand and can get our policymakers to get on board with the reality that we have to get off fossil fuels and we have to do something much more than we've ever done for those communities, but I can't. But at least I can tell you and the folks listening that we have to do better here. We have to do better.
Right. So if anybody out there who's just joining us, I'm Barbara Moran, the WBUR's environmental editor. We're live tonight with Dr. Aaron Bernstein. He's a pediatrician at Children's Hospital in Boston and also at Harvard School of Public Health. And we're talking about the connection between COVID-19 and climate change. And we welcome your questions. You can go online to slido.com, enter the event code WBURVTH5 and send us your questions. So I wanted to turn a little bit to talk to some sort of big picture things. Right before the break there, you said the words, "I'm not an environmentalist, I'm a doctor." I like that. It's very Star Trek. It's like, damn it, Jim, I'm a doctor, not an environmentalist. So, but I wanted to talk a little bit about, because you run this program called Climate MD, which is this Harvard program to get physicians to talk to climate change about patients and make it relevant. So do you worry that by bringing climate change into a conversation with your patients, you'll turn them off? Or how does that happen?
That wasn't where I thought you were going to take that question, because I don't necessarily, we talk about this all the time, doctors who are concerned about climate change, do you talk to your patients about it? And I think there are circumstances, and I have colleagues who do, where it is appropriate. And a good example of that might be around like allergies, which are happening, pollen season starting sooner, it's more severe, and some people have really bad response to allergies. And, people coming in, like early March with like seasonal allergies, and they'll be like, and the person will be 67 years old, and they've, their allergy experience has been allergies start in May, and in those circumstances, they want to understand why. And the answer is because the planet's warming, there's more carbon dioxide, and those things are making allergies start earlier. I mean, that's just fact. So, but in most cases, I think that the reason that I think doctors and clinicians are so important, there are two main ones. It's not necessarily to talk to our patients, although I think there are appropriate times to do that. I think it's because, first of all, we need to get our own house in order. We are responsible for maybe 10% of the greenhouse gas emissions in the United States, healthcare. And there are some 400 healthcare systems in the United States. Only a couple of dozen have even done the first pass at reducing their carbon footprint. That is not okay. We need to do better. The second is that climate change, when I started, I remember even before I started, the founders of our center had a symposium at the Rio Earth Summit. Rio Earth Summit, probably the most important environmental summit in history. It's where the UN framework on climate change was started, which led to the Paris Agreement, the Convention on Biological Diversity, a whole suite of really important work got done. And they had a symposium which was named Where's Health at Rio? Because no one was talking about health. It's like all these, we can transform the climate and eradicate life on Earth. And that was terrible for the planet and the polar bears, but it didn't really matter to people. And so there's been this astonishing disconnect between these problems and health. And to your point, we need to connect the dots better. Well, now, fast forward, several decades, and health is very much a part of the climate conversation, but it's population health. Climate is going to be bad for malaria. Climate is going to be bad for the health, nutritional status of populations. All true. But it also is going to be, and already is, incredibly important for doctors being able to do our jobs. In 2018, Hurricane Maria hit Puerto Rico, right? Fall of 2018. In the spring of 2019, I was getting warning signs when I tried to prescribe IV fluids to children saying, we don't really have enough of this, be careful, don't use too much. That's because Maria knocked out of commission a single plant that provided small volume IV bags to the entire United States. That had knock-on effects that made it essentially many months later impossible for me to do IV fluids. Hurricanes in the Atlantic are getting stronger because of climate change, and the healthcare system is at risk. And that's an example where, even though hurricanes hopefully won't hit Boston like that anytime soon, events far away, we can hope, can really matter. But then there's much more proximal stuff like, around the history of mental health in the United States, with the Kennedy administration, there was the policy of deinstitutionalization, right? So people were held in insane asylums, more or less. And with the advent of new drugs, the decision was made for any number of reasons, but the drugs were part of it, that people should be in the community and we can get them on these medications that are going to help. Well, in the aftermath of that, there were a series of papers about patients taking some of these medicines dying in heat waves because some of those medicines affect our ability to deal with sweating, affect our ability to deal with heat. And you can imagine that certain mental health conditions can really impair some people's judgment. Well, now we see this happening all over again. It's deja vu all over again. We have, some of the medicines that are most commonly prescribed in the United States, medicines for heart disease, blood pressure medicines, medicines for inflammation like NSAIDs, like ibuprofen, and certainly many of the mental health medications like SSRIs are all medicines that affect our body's ability to sweat and to deal with heat. So we have rampant rates of use of medications, which are generally very safe and certainly helpful to the people on them. But the changing piece is the temperature outside. And again, we talked about how Boston people are not used to it. So research, and there needs to be much more research into this, but the research that we have suggests that many of these medications are increasing the risks of people needing hospitalization. And that's not terribly surprising because we've known for a long time that these medicines affect our body's abilities to deal with heat. And we're seeing these unprecedented heat waves. So go figure. So doctors need to know about this. We need to do research about this. And frankly, given what we know now, if I'm starting a child on a long-term medication that I know can affect their heat ability, and it's May, I'm probably we should be careful in the heat in the summer in general for a whole variety of reasons. But, this medication may make it harder for this kid to get heat out, and just be mindful of it. Make sure the kid's drinking water, make sure they're able to cool off. And in the same way that I'm responsible when I prescribe an opiate to someone who operates a forklift, right? I'm not going to give that person an opiate knowing that that medication can impair judgment and not say anything. So there's a there's a very concrete series of things that we need to get into the medical community mind. And then, of course, there's research showing that on the issue of climate, which, as you alluded to, is heavily politicized in the United States, when you talk about climate change as a personal health issue, and the reality that it is a personal health issue that affects people's health, the safety of medications, the ability of doctors and nurses and pharmacists to do our jobs, that is transformative, that it depoliticizes it, especially when it comes from the primary care provider. Just as we're seeing now with COVID, that when you ask Americans who they trust, it's their local health official more than the state, more than the federal. We see the same thing here. And so I think for all these reasons, we're trying to focus our attention really on healthcare as a way to, one, better prepare healthcare, hopefully get our shop in order, and really to help articulate these dots that need to be connected so that we can all feel that we can move forward towards a path that's going to be better for health and for a livable future for our children at the same time.
You, before we, just to open this up a little bit, can you talk to me a little bit about some of the parallels you've seen with the federal government response to this virus as well as climate change, as far as anything, in the mistrust of science, or I don't know, the politicization. Sorry, I don't know how to say the word. How they've taken these topics, and I don't know, or they seem related. How they've been dealt with, how they've been politicized. Do you have any? I don't know.
Well, in some ways, you're asking me to explain the inexplicable, but I think one thing that's clear is that science is not another belief system, right? Science is a system. It is an imperfect system, but it does lead to the discovery of realities that can really make people healthier. And an armchair scientist, having a relative who's a scientist, is not the same thing as someone who spent their career focused on a specific issue and understands it thoroughly. If I want my child who has cancer to be treated for cancer, I'm not going to take them to, a psychiatrist, although that may be part of the therapy. I'm not going to, take my child, as much as I love, music, to a musician to heal them, although music therapy may be part of it. I'm going to take that child to someone who knows as much as anyone about how to treat childhood cancer. And I think that the issue I see right now is that there are many folks, we see them on TV all the time, who are immensely competent in terms of their knowledge. Tony Fauci has been doing this forever, starting with HIV as one good example. But there are lots of other people who are essentially claiming knowledge over domains of which they have no worldly experience. And they're not humble enough to recognize the limitations and the risks of being so strongly opinionated about things that really matter to people's lives. I mean, when I work with residents in the hospital, I especially new residents, interns, I say the only mistake I can't stand, and just to reassure parents, I've been doing this a long time. We have astoundingly competent residents where I work. And in fact, you're in better hands with them than you are with me in most cases. But the point is that the only mistake I can't tolerate is the mistake that's made when you're uncertain about what to do and you proceed anyway, because there are so many people around who could help, who've thought about who I guarantee you have thought about the problem you're facing. Many of people who have studied it and this is our challenge right now, which is we have got, in Boston alone and around this country, thanks to the investment, frankly, of taxpayer dollars, we have cultivated the world's finest crop of public health scientists. And to not take advantage of that investment is insane, especially when so many lives are at stake. And so, you see this at the state level. You see some states where the public health officer is the front of the operation, that they're talking about it. The politician is there, but they recognize that their role is to work on the public communication point. But when it comes to decisions, there's people that are there who have been trained. But you don't see that everywhere. And so, we can get lucky. I hope we do with some of these reopenings, which, are happening at various paces in various ways. But and to be clear, science is not perfect. The models are not perfect. And so even the best scientists are going to make estimations that don't reflect exactly what happens. But to choose a different path, which is to throw a dart at a dartboard and just hope that works, is completely irresponsible. And so, I think the key point here is that science matters, that there are people who are immensely knowledgeable, who spent their careers working on these questions, who have been supported by everyone's taxes, and why wouldn't we turn to them at a moment like this to help us?
We are almost out of time. It sort of flew by, I have to say. So I wanted to ask you to do one final thought for us. I think talking about and thinking about these issues can be really discouraging for a lot of people, thinking about climate change and thinking about the pandemic, and it sort of gets people down. But, when we've talked before, you often have some sort of hopeful messages about going forward and some opportunities that this might give us. What are some silver linings to be gotten out of this?
Yeah, no, I thank you for that opportunity, Barbara. There's no question that this is it's hard to imagine circumstances short of, a war in our midst that would be more challenging, right? I mean, this is economic hardship, it's emotional hardship, it's the uncertainty about what's coming down the road. And so I think to the extent we can, and to the extent that, people are ready to hear news about what might come next, because, there's a lot of change going on. I think we need to recognize that in the ashes of this, in the ravage of what's gone on, the jobs that have been lost, the lives that have been lost, and the uncertainty that's been created, there are actually opportunities to do better. And there are things that, as I was talking about before, we need to be doing to invest first and foremost in the health of people here in Massachusetts and around the United States, particularly the health of people who are vulnerable, like the people in Chelsea, as we talked about. And if there has been a moment in human history where this has been clear, I don't know it. We can do everything as individuals to protect our health. We can exercise, we can eat the right foods, we can listen to all the crazy advice that people like me want to give out about how to live a healthy life. But it turns out that our health is no better than the health of the most vulnerable people in the societies we live with. And so the actions we can take to reduce air pollution in poor communities that will improve their health, the actions we can do to make sure that they have access to transportation systems that are equitable and accessible and give them opportunities to exercise, to reduce the strains of financial hardship that strain families, create adverse events in childhood that have lifelong effects on those children. All the things we've been talking about in the solution space that both address health. I mean, think about, and there's another good example, obesity. What's causing obesity? It's the dietary issue and the transportation issue. That these changes that will improve health, that will buffer us against the next pandemic, which hopefully will never come but may, that will really improve the health of children and people who are older, people who are vulnerable, women who are pregnant, can be done right now with the unprecedented amount of public funding getting pushed into the economy. So my hope is that with every decision that gets made about where to put this money, we're thinking about health, and particularly the health of the most vulnerable. And when we do that, we're not just going to make people healthier now. We're going to provide for a livable future and a more just future, which is better for everybody. And as I said, this is an unprecedented opportunity. It's not an opportunity that anyone wanted to create through the means it's been created, but here we are. And there's a lot of money being spent. And the beauty of our moment is also that these things are within our reach. Renewables in the United States are cheaper than fossil fuels. Here's a surprising statistic for you. Which states in the United States have the highest percentage of electricity from renewable energy sources? What do you think?
Texas.
Texas has a lot, but it's a percentage of the total. They're not in the top several. It's places like Kansas, Oklahoma, South Dakota, and Iowa, those deep blue states that believe, in socialist, environmental, communist, whatever. And they're doing it because, one, they have the wind energy, and two, they see it's inexpensive, right? So we're at this moment of opportunity where renewables are cheap. Massachusetts, by the way, has some of the best programs in the country. We should be very proud of the incentives we place on renewables in our state. So we have this opportunity to leverage the fact that these things are available. We've got huge amounts of funding coming in from our own government, our own dollars, into our economies. Can we seize this moment and put us on a path that really is going to serve us better, not just in the long run, but right now?
Great. Thank you for ending on that silver lining. I'm afraid we're out of time, everyone out there. Thank you so much to Dr. Ari Bernstein for joining us on our 5th WBUR Virtual Town Hall. Thank you so much. It was a pleasure. And thank you to all of you out there who submitted questions. I'm sorry there were so many we couldn't get to them all. I hope you will join us again next Tuesday at 6 when WBUR's Kathleen McIerney, our education editor, leads a conversation on the potential long-term effects of the pandemic on learning and families. Her guest will be Tabidi Brown, head of school at Codman Academy Charter Public School, and Margaret McKenna, president emerita of Lesley University. Thank you again, Dr. Bernstein, and thank you all for coming. Take care. Have a good night.